Okay, wonderful. Well, welcome everyone. A little bit of a production to put this on, but we are completely set and ready to go. Thank you all so much for being here with us today and for joining our Care Management Training Initiative. It's right now 10:03, and I apologize for starting a little late, but we wanted just to give some time for more people to sign up. But in the interest of time, we're just going to get and dig right in. So this Care Management Training Initiative is for the New York City and Long Island region, and so welcome and thank you so much for being here. My name is Ruth Colon Wagner, and I'm with NYAPRS of the New York Association of Psychiatric Rehabilitation Services. And we are an organization that is really a partnership between people who use and those who provide mental health services, and we're real committed to promoting recovery, rehabilitation, and rights for people with psychiatric conditions. And we do this through a variety of activities, and that really includes advocacy, education, training, technical assistance to organizations, employment campaigns, cultural competence. We have a very active cultural competency committee that puts on webinars and informational sessions, and of course peer services. So we really do have strong advocacy, and all of our services really are statewide, and we also have a national footprint, so we're very proud of that. Management Training Initiative, with great thanks to the New York State Office of Mental Health. We're really able to bring this to you, to deliver this to you, our Care Management Training Initiative. And I want you to know we're not new to this. This is actually our third implementation of this training. And for this third session, this third phase, is for the New York City and Long Island region. Prior to just in New York City and Long Island, we've had the two prior phases, and that was all for upstate or every county north of New York City and Long Island. And we've had such a wonderful experience with these phases, with these trainings, and such a tremendous response to the training from the participants and the trainees that we're really pleased to be able to bring this to New York City and Long Island as well. This is a 12-month commitment on all of our parts, and it's designed to help strengthen the care management workforce so that you can work with individuals and really help them achieve positive outcomes for themselves. Things you're going to notice as we continue, we have you all identified in 3 regions. Region 4 is Manhattan and Bronx. Region 5, Brooklyn, Queens, Staten Island. Region 6 is Long Island, and the counties that make up Long Island. And the reason for starting at the number 4 is because we've had other phases, and so in upstate we have 2 regions, and those are regions 1, 2, and 3. So we just want to get you mixed up with that. Now, NYAPRS cannot and has not done this work alone. We partner with the very best in our healthcare industry, and it is our pleasure to be working with these organizations. Now, the New York Care Coordination Program, where we work with Adele Gorgeous, Christy Mangione, and Diane Neufel. Others. There's always among others for each of them. We also have the pleasure of working with the Center for Practice Innovations. And there we work with Paul Margulies and Nancy Coble. We also have the pleasure of working with the New York State Council for Community Behavioral Health Care, and that is City Levinois. And we also have the pleasure of working with the Coalition of Behavioral Health Agencies, and there we work with Laura Langer, Margie Staker, and Bradley Jacobs. And Laura's actually joining us here today. So let's get on with this. I'd like to bring on Adele Gorgeous now so that she can speak about YCP.
Good morning. The New York Care Coordination Program is a long-standing, multi-county, multi-stakeholder, collaborative undertaking aimed at improving health care and life outcomes for individuals with serious chronic health issues. The core of this transformation work has been development of a care management practice that is person-centered, recovery-focused, integrated, and culturally informed. This approach has had measurable results over time, quality care, better social outcomes, low mental health costs, and lower mental and physical health costs. Given those very positive results, this approach has informed the work of HONEY, the 22-county health home undertaking, which the New York Care Coordination Program is managing. This approach is also the base of the training we're doing in partnership with NIAPRS for the Care Management Training Initiative. We look forward to working with you on it and sharing what we've learned over the years.
Thank you so much, Adele. Now I'd like to bring in our partners at the Center for Practice Innovations. I believe Paul Margulies is going to speak. He is the Associate Director of Practice Innovation and Implementation with CPI. Paul?
Thanks so much. Thanks so much, Ruth, and good morning, everybody. We're very much looking forward to working with you throughout the course of this next year. For those of you who are not aware of the Center for Practice Innovations, I'll just give you a very quick overview. We support the New York State Office of Mental Health's mission to promote the widespread availability of evidence-based practices to improve behavioral health services, ensure accountability, and promote recovery-oriented outcomes for consumers and families. We do that in many different ways. We do it through online training and webinars and modules, and we do it through face-to-face training as well. 3 primary goals for CPI. First is to promote the widespread availability of behavioral health evidence-based practices in New York State. And we really do reach as far as Buffalo to Long Island and everywhere in between. Second is to promote innovations related to emerging promising practices, adaptations, and organizational change approaches that support the implementation of quality services for individuals with serious behavioral health problems. Third is that we create informational and educational resources for the general public. This includes consumers as well as family members, as well as users and providers of behavioral health services. Thank you so much.
Now I'm going to bring on Cindy Levinoy. She's the Director of Communication and Member Services for the New York State Council for Community Behavioral Health Care.
Thanks so much, Ruth. Hi, everyone. Welcome to our webinar today. We're really pleased to be joining with NIAPRS and all of the other partners on this project. We've worked with NIAPRS on all 3 of the Care Management Training Initiatives. So we're pleased to be here again. By way of background, the New York State Council, we are a statewide not-for-profit membership association. We represent approximately 100 behavioral health, which are the mental health and substance abuse prevention, treatment, and recovery organizations across New York State. Our members include freestanding community-based agencies, hospitals, and counties that operate direct services. And similar to what Ruth described earlier, our association also advocates for these providers. So we do a lot of legislative work and working on your behalf to make sure that the state policies and procedures are in your best interest. We provide educational training for our members and offer some technical assistance as well. So again, we're thrilled to be joining with NIAPRS and the other partners, and we look forward to working with you over the next year.
So much, Cindy. Now we're going to bring on Laura Langer. She's the training facilitator with the Coalition of Behavioral Health Agencies in New York City. Laura?
Yep, I'm sure many of you are aware of the Coalition. It provides technical assistance and training to staff and its member agencies and to the professional community on critical issues related to rehabilitation, recovery, organizational development, best practices, quality of care, evidence-based skills, billing, and regulation. The Coalition frequently seeks and secures funding for its members to conduct meaningful projects in critical program areas. Our many events, meetings, collaborations, and facilitated networking create collegiality and community among the members. The Coalition's aim is to coordinate government and private sector efforts towards the delivery of quality behavioral health services to children and adults of all ages, backgrounds, enabling them to lead productive lives in their community.
Very much. Now let's talk about sign up. I've had a couple of emails wondering if you're signed up. Well, in the simplest forms, if you've already completed form, the e-form that we gave you the link to in the first letter that you received, then the answer is simple: yes, you are signed up. If you provided your information and you provided the email addresses of those of your team, the care managers, then we are currently in the process of signing everyone up. I do want you to know that sometimes people don't get emails from us, and so we ask that you really look at the emails that you gave us. Sometimes they're wrong, and so make sure that we're all on the same page. And you'll be getting information from us every single month where we're taking attendance and showing you attendance reports. And all of that will be just really useful information on your part so that you are up to speed in terms of your staff has missed, if anything, and what they need to take. And then we'll also find out through that process as well. It's a pretty organic process, and it can take a while to find out if there's an error in email. So please, if you ever find anything like that out, we're really asking you just to reach out directly to me, and my email address is provided at the end here. So for the care management training, we do have 2 tracks, as you may have already noticed. We have a track for care managers and a track for supervisors. The manager track is really the most direct, the most simple. They have 5 training webinars over the course of 12 months, so not really labor intensive on their part. And in addition, we provide the training live, and we also archive the webinar so that if someone's, in the field or doing their work or called out sick or whatever, they always have access to what was presented live, and we do take attendance regardless of live or archived, because at the end of the entire 12 months, we're looking for everyone, care managers and the supervisors, to have completed each and every activity. Oh, before I move on, I do want to talk about the live. It's really important as much as possible. And I know sometimes, especially in your line of work, there's a lot of field work that you can't always be in the office, which is why we provide this also to you archived. But it's really just so critical. If you have the ability to watch it live, that really is best, not just for you as the supervisor, but for your care management staff. Because what Paul is going to also talk about, the supervisory track, really would lay out why things are so important to take them live.
Much, Ruth. So if you're a supervisor, we're offering a lot more. Beginning, of course, with the same 5 training webinars that Ruth just described, but there will also, in the course of the year, be 3 regional face-to-face meetings where supervisors can come together and learn with and from one another. There also will be a number of online learning collaborative meetings. And these are really going to focus on the supervision of the specific competencies that we're going to cover throughout the year. So one kind of meeting, is a supervisor learning collaborative call, and that's where we'll discuss, for whatever the topic is, approaches to supervision of that topic. A second kind of online meeting is a regional implementation planning call, and that's where, together we can talk about literally how to roll out the supervision and talk about your experiences in doing the supervision. And once again, it's a real nice opportunity for supervisors to learn from one another. And when we've done this in the past, we found that in many ways this is such a robust and such a rich experience, because people really do get a chance to pick each other's brains and learn from one another. We think that's very, very important. So that's the package for supervisors. Now, we're giving so much to supervisors because the bottom line is that we understand, as I know you do, supervisors are key in working with the care managers. I mean, without supervision, it's very hard for folks to really implement in a regular way. Supervisors provide the support, provide the encouragement, and provide some content. And so this is a very important aspect of this initiative. If we look at the next slide, please, Ruth. How are we going to structure? There are 5 topics, as you know. For each topic, there is a webinar for the managers and for the supervisors, and it focuses on the specific care management competencies. There's a learning collaborative online meeting for supervisors, and the focus is on supervision of those specific competencies. There's the Learning Collaborative Regional Online Meeting for Supervisors. And we're going to talk about, the supervision and people's experiences and review accomplishments and looking at challenges and really learning from one another. And then interspersed throughout this year are 3 face-to-face training sessions. So you see how this all comes together. Thank you.
Thank you, Paul. Now I'd like to bring on Christine Mangione of NYCCP.
Good morning, everybody. So on this slide, you'll see the 5 topics that we'll be covering for this training initiative. For the first webinar, we'll be covering outreach, engagement, and retention. And here, the participants will gain an understanding of why outreach is essential to the health home care manager and how engagement strategies such as motivational interviewing, person-centered practice, trauma-informed practice, and cultural activation prompts support effective outreach, engagement, and retention. So the second webinar is Understanding Complex Needs. And here we'll provide information about interventions that will assist individuals in reaching their healthcare goals that they've established for themselves, as well as instruction about when to intervene as a care manager based on the assessment of that person's readiness for change. The third webinar, titled Navigating Complex Systems, will focus on managed care organizations' expectations for health home care managers. Participants will be introduced to engagement strategies to use with providers that can lead to an improved experience for both the enrollee and the provider, and will identify ways in which health home care managers can support the individual's health care goals. Participants will also learn about HEDIS measures as well as the process of communication and collaboration with managed care organizations, case management department, and case managers. In the fourth webinar, Effective Outcomes Measurement and Management, participants will gain a better understanding of how health home core quality measures are an integral part of the larger payment and healthcare delivery system, as well as the importance of outcomes to managed care organizations, the Department of Health, and health homes. And finally, for the fifth webinar, Workload Management and Using Technology to Enhance Productivity and Effectiveness, financial modeling tools for various caseload mixes and care management team configurations will be presented along with their expected impact on effectiveness and productivity. The presenter will provide an overview and examination of new technology in the marketplace developed to assist care managers in engaging with vulnerable populations, as well as its potential to make high caseloads manageable by supporting low acuity individuals. Each content webinar will focus on a set of care management competencies, and these will serve as the focus during the learning collaborative calls that Paul has referred to. Also, prior to each webinar, you'll receive an email from Ruth providing the login information. Thank you.
Thank you so much. Now I'm going to bring on Laura Langsner from the Coalition.
So all face-to-face sessions will provide supervisors with an opportunity to practice the skills that they've acquired through the webinar and the learning collaboratives, as well as develop competency. The first face-to-face will also provide information about healthcare changes and how the health homes fit within those changes. These sessions are a full day and incorporate both small and large group activities, as well as face time with your peers.
Okay, great. Thank you, Laura. I'm going to bring on Nancy Cubble. She is the Associate Director of Implementation Support Services for the Center for Practice Innovations. Nancy?
Thanks, Ruth, and good morning, everybody. The other part, in addition to the work that we'll be doing with Paul and with the supervisors directly, is we are using the Center for Practice Innovations learning management system to deliver all of the training and notifications to you. So we are in the process of setting everybody up at this moment, and I do apologize it's taken longer than we were hoping. The good news is that we have, by my estimate, somewhere between 750 and 1,000 people to get into the system. So that's wonderful news that we have so many care managers and supervisors enrolled. Once you are enrolled, you'll receive a welcome email that will give you instructions around how to log in. And when you log in, you will see this landing page very specifically designed for this initiative, and you will see that there is a box called Your Transcript on the lower left-hand side, and from there you can open the curriculum that allows you to view any of the training or the archived webinars, and you will also be able to do the pre-test. I wanted to let you know we are automatically assigning people into the required webinars and sessions, so you won't have to go into the system and look for and register for those events separately. Next slide is an example of the pre-test. Thank you. And when you get the welcome email, you will also have instructions around how to go into the system and complete the pre-test before our first overall webinar. And we really would like to encourage everybody to please take the time to go in there and complete a few questions. I think it'll take maybe between 10 and 15 minutes. Care managers and supervisors both have pre-tests. And if you have any questions, our CPI Help Desk staff email is listed on the final slide in this presentation. So we look forward to working with you.
Thank you so much, Nancy. You know, we have a couple of questions already coming in, and people couldn't find the pre-test. And so just like Nancy just mentioned, everyone needs to get signed up to this particular care management training initiative curriculum. And so you may already have an account with CPI's learning management system, but they need to do the work on the back end. And once they do that, you'll get the information on how to log in, and then you can access these assessments. So thank you for your question. Okay, so I want to bring in Cindy Levenoy back to talk about outreach and engagement.
Ruth. Hi again, everyone. Ruth mentioned at the very beginning, this is a 12-month initiative, and we know that it will be, while it's not as labor-intensive for all of you, the care managers, with the 5 webinars, we are going to be keeping track of who's participating, and we will be doing a lot of reminder calls and reminder emails for everyone to make sure that everybody knows when everything is going on and to make sure that we get everybody signed up. In addition to that, as you go through, we will be keeping track of attendance. Since this is a New York State Office of Mental Health grant that we've received, part of our requirements from the grant end of it is that we need to track the attendance of those people that are participating, and our goal is to have everyone participate in all of the activities, all of the webinars, and then for supervisors, all of the webinars and the face-to-face and the follow-up. So we'll be able to do all that and track all that, and we'll be sending monthly attendance reports to everyone. Supervisors will receive a listing so they'll know which one of their staffs have participated in which activities, and then as a supervisor we'll have a listing for you as well, just so that you can keep track and monitor for yourself what things you've participated in. As Ruth mentioned, all the webinars will be archived, so for those staff members that you have that weren't able to attend live and will show up as sort of being absent for that webinar, they'll have an opportunity to go back into the learning management system that you just saw from Nancy and be able to go in, view the archived webinar, and then be able to mark it as complete, and then it will show up on our listing for the next month's participation as that has been completed. Since this is, in addition, a 12-month initiative, we also know that there may be some staff turnover along the way. If that occurs, we encourage you to, one, if you have staff that leave, to let Ruth know. She's probably the best person to start with. Send an email to Ruth, and at the end of this webinar, you'll see all of the emails for everyone. Send an email to her so that she can let Nancy and folks know who needs to be taken out of the system, so that way we don't continue to bug you every month for staff members that need to take the webinars if they've left your organization. In addition, if you have new staff that join, we encourage you to sign them up and have them join and participate in this initiative. We know that it may be midway through, but since the webinars are archived, they're able to go back, start at the beginning, take the ones that they've missed, and then kind of pick up sort of where they start. So if they join your organization midway through, they can still join this initiative. We want to just make sure everybody knows that. They can still join. They'll just go back, do the archived webinars for the first couple they missed, and then pick up the next ones live. You'll see up above where it says reminder calls and emails on this slide, you'll see a list of folks, any one of us you may get an email from. Predominantly, our organization and the coalition have been tasked with helping Ruth with doing the outreach and engagement. So you probably see a lot of information from us, but just so that you're aware, you may get things from Ruth and or Judy from NIAPers, but most likely you'll see stuff either from me or Margie or Bradley from the coalition.
Thank you so much. Very, very well said. Now we have a steering committee, and we'd like just to put this out there if this is something that you'd like to join me on. What we typically do is every time we have a phase, we bring together a small cohort of individuals, of participants who are actually taking the training, and so that we can receive your feedback on the curriculum and on how the training is going, and then actually have conversations about how this is being implemented in your programs. And so if this is something that you'd like to join me on, we have phone meetings. We'll probably have about 4 meetings throughout the 12-month initiative. And so my email address is there. Please use that and get in touch with me and let me know if that's something you'd like to do. As we talked about, here are all the emails. And so we do ask you to allow access through your filtering system to these email domains. And I know some of us have really, really aggressive software to keep out junk mail. There isn't junk mail, so please see what you can do to make sure that these addresses can go through, not just for yourself, but also for your team. This is actually a screenshot of something I'm hoping you already received. And if you haven't, I am going to do my best to send it to everyone as soon as we get everyone signed up through the learning management system. And so this first page here has actually the most important dates I need you to know for right now. And today, obviously, is the welcome webinar that's in the light green. And you'll notice everything is color-coded, and the pale yellow, those are all the face-to-face sessions. And so those dates are coming up very, very soon. So really wanted you to have that information ahead of time as we all plan our March and the upcoming spring season. You've got that too. The first webinar is on Tuesday, May 5th. You've got those dates there. At the bottom here, you've got the addresses, the locations for the 4 regions, and 2 of those, so for all of New York City, that's going to take place at the Coalition of Behavioral Health Agencies down in Lower Manhattan. In Long Island, that'll take place at the Tech Resource Center in Farmingdale. The rest of these slides has the rest of the dates, and that is the third slide with the final dates. And so you see the 3 face-to-face sessions are really broken up into 3. So the first one, I'm going backwards. The first one is this month in March, 1 for each region, 7 days. And then the second face-to-face is in the summer. And the last is in March, so 12-month initiative. We may end up changing some of these dates. We may end up changing some of the implementation planning calls, and we have all that communication with you through email. So it's really important for you to look at our emails when they come in. So that being said, I cannot believe our half an hour is done, and I thank you all so much for joining us today and for joining our Care Management Training Initiative. We look forward to working with you for the next 12 months, and NIAPers thanks all of you, and of course we thank our collaborators on this project. Thank you all so much. Have a wonderful day.